2 sweet fruits that help control diabetes, doctor's advice. Introduction. Sweet but not harmful. When it comes to diabetes, most patients immediately think they must avoid anything sweet, especially fruits, but modern medicine has proven that not all sweetness is dangerous. In fact, some fruits are sweet yet act like gentle gatekeepers, helping stabilize blood sugar, reduce inflammation, and even improve overall health. Today, let's explore 2 fruits that are not only delicious and naturally sweet, but also remarkably smart: blackberries and strawberries. 1. Blackberries. Nutritional functions. Blackberries, with their deep purple hue, are packed with fiber, vitamin C, vitamin K, and especially anthocyanins, powerful plant compounds with strong antioxidant properties. They provide natural sweetness while also regulating how the body processes sugar and starch. Benefits for people with diabetes. Stabilize blood sugar with fiber. 1 cup of blackberries contains nearly 8 grams of fiber, which slows down digestion and glucose absorption. Think of glucose as cars entering your bloodstream. Fiber is the toll booth, forcing them to move slowly instead of rushing all at once. Improve insulin sensitivity. Studies show that anthocyanins in blackberries help cells respond better to insulin. In other words, they make it easier for glucose to enter cells. Reduce inflammation and oxidative stress. Type 2 diabetes is not just about blood sugar, it's tied to chronic inflammation. Blackberries help extinguish the fire in the body, lowering risks of cardiovascular and neurological complications. Slow starch breakdown. Compounds in blackberries inhibit the enzymes amylase and glucosidase, which normally break starch into sugar. This means carbs from rice or bread turn into glucose more slowly, preventing post-meal roller coaster spikes. Practical use. Eating a small handful of blackberries daily is enough to make a difference. This is not a numbers game but a test of consistency. Combine blackberries with protein and healthy fats like plain Greek yogurt, chia seeds, or almonds. This slows digestion further, keeping blood sugar steady like a smooth melody. Enjoy them fresh or frozen. Frozen blackberries retain nutrients and sometimes even more antioxidants since they're flash frozen at peak ripeness. 2. Strawberries. Nutritional functions. Strawberries are often called the fruit of love, but for diabetics, they hold another special role. They provide vitamin C, fiber, anthocyanins, and L-argitannins, a rare type of polyphenol that regulates carbohydrate digestion. Benefits for people with diabetes. Low in carbs. Blood sugar friendly. 1 cup of sliced strawberries has about 12 grams of carbs, far less than mangoes or grapes. That means you can enjoy their sweetness without too much worry. Lower post-meal blood sugar. A study in the British Journal of Nutrition showed that eating strawberries alongside a starchy meal significantly reduced post-meal glucose compared to those who didn't. L-argitannins, the starch gatekeepers. This compound slows carbohydrate digestion, allowing blood sugar to rise gradually instead of spiking and crashing. Fiber for stability. About 3 grams of fiber per cup of strawberries acts like a net, holding back glucose so blood sugar doesn't flood too quickly. Anti-inflammatory and vascular protection. Antioxidants, especially vitamin C, reduce inflammation within 6 weeks. This is crucial since chronic inflammation drives complications in the heart, kidneys, and nerves of diabetic patients. Practical use. 1 to 2 cups per day is sufficient. Don't assume the more the better, as even strawberries contain natural sugars. Choose whole fruit over juices or smoothies, since blending breaks down fiber, allowing sugar to absorb faster. Avoid pairing strawberries with sugary foods like sweet cereals, whipped cream, or jam. Instead, combine them with fresh cheese, unsweetened yogurt, or a handful of almonds. Pick fresh or unsweetened frozen strawberries. Processed products like syrups or jams often contain more sugar than a candy bar. 3. The blood sugar-friendly bowl formula. Here's a simple recipe I often recommend as a breakfast or afternoon snack. A handful of blackberries, a handful of strawberries, plain Greek yogurt, 1 tablespoon of chia seeds or flax seeds. A few almonds or walnuts. A sprinkle of cinnamon. When eaten together, this combination not only tastes delicious but also acts like a shield for your blood sugar. Fiber slows absorption. Protein and healthy fats keep energy steady. Polyphenols reduce inflammation, and cinnamon improves insulin sensitivity. It's the perfect harmony of flavor and health benefits. Conclusion: diabetics don't need to completely abandon sweetness. The real question isn't whether to eat sweet foods, but how to eat them, which fruits to choose, and in what context. Blackberries and strawberries are prime examples of sweet yet smart. They deliver nutrients, stabilize blood sugar, fight inflammation, and reduce risks of complications. If there's one piece of advice I'd like you to remember, it's this: treat these berries as nature's gift, a natural form of medicine you can enjoy daily without a prescription. Eaten correctly and in moderation, they become long-term allies in living well with diabetes. And always remember, as I often tell my patients, nature already knows how to care for us. Your job is simply to listen and make the most of it.